Good morning, Cadence. My name is Kristen and I will be your nurse. So, can you tell me your name and date of birth? Cadence Souza, 12/4/86. Perfect. So today you are seen in our office with a diagnosis of postpartum preeclampsia. I will be going over some key points about your diagnosis to help you better understand it and also reviewing your discharge instructions with you. So, postpartum preeclampsia is a rare condition that occurs when you have high blood pressure and excess protein in your urine soon after childbirth. Most cases of postpartum preeclampsia develop within 48 hours of childbirth, but in some cases it may develop in the 6 weeks that follow. This is known as late postpartum preeclampsia. Postpartum preeclampsia requires prompt treatment. If left untreated, it can cause seizures, organ damage, stroke, or other serious complications. Postpartum preeclampsia can be difficult to detect on your own. In fact, many women who experience it show no signs or symptoms during their pregnancy. Also, you might not have suspected anything was even wrong because obviously after you have a baby, you're recovering, you're caring for that beautiful newborn. It's difficult to pick up on the signs and symptoms. So signs and symptoms of postpartum preeclampsia include high blood pressure, excess protein in your urine, severe headaches, vision changes such as flashes of light, blurred or double vision. Pain. It can also be pain in your mid or right upper quadrant of your abdomen, nausea, vomiting, new onset shortness of breath, or even decreased urination. So here in our office, we have determined that there is a persistent elevation in your blood pressure, trending at 140/90, documenting sometimes much higher than that. We also did a urine. Your urine shows excess protein, which is how we came up with the diagnosis of preeclampsia. So, do you have any questions so far? Okay, then I'm going to continue. So preeclampsia puts stress on your heart and other organs. Any pregnant woman can develop it. However, some women are at greater risk. Women with a history or family history of preeclampsia, women older than 35, women who are pregnant with multiple infants, women with a history of obesity, diabetes, lupus, hypertension, or kidney disease, and also those who use the process of in vitro fertilization. These women are all at risk of developing preeclampsia. Cadence, thank you for asking what causes preeclampsia. Preeclampsia is associated with abnormalities in the development of the placenta very early in pregnancy. A cascade of events may subsequently occur that can damage blood vessels throughout the mother's body and cause this clinical syndrome. Why this happens to some women and not others is not completely understood. Can it be prevented? Okay, so there are no tests that reliably predict who will get preeclampsia, and there is no way to completely prevent it. Doctors do recommend that women who have risk factors are placed on a low-dose 81 milligram baby aspirin to reduce this risk. Low-dose aspirin is usually started in the late first trimester, around 12 to 14 weeks, and it is continued into the third trimester of pregnancy. We typically stop that at 36 weeks. Taking aspirin while having an active and healthy lifestyle could help prevent preeclampsia in future pregnancies. Okay, so can you give me 5 bullet points about preeclampsia? Can you list the signs and symptoms for me? Okay, great. So I can see that you have a very good understanding of what preeclampsia is. So now let's review your discharge instructions. Dr. Matthews will see you back here in 6 weeks. We've already made the appointment for you, and it is very, very important that you come to this follow-up appointment. We want to make sure that we're following you in this journey and that we're helping you along. Also, we want to make sure we're going to prevent further complications. So nothing is allowed inside the vagina for those 6 weeks. There are no activity restrictions, so feel free to resume your daily activities. Walking for 30 minutes a day is a great way to start feeling good again. There are also no diet restrictions. However, providing a heart-healthy diet can help. Limiting sodium can also help with that high blood pressure. For example, we want to limit added salt when cooking and avoid commercially prepared and packaged foods whenever possible. Generally, the more processed a food is, the more sodium it will contain. Dr. Matthews has prescribed Tylenol 650 milligrams every 6 hours as needed for pain, along with Motrin 600 also every 6 hours as needed for pain. These two medications work best if taken 6 hours apart, so you want to rotate them. Do you have any questions about that? Okay, so continue taking prenatal vitamins until your follow-up visit. Dulcosate sodium, which is a stool softener, has also been prescribed to keep stool soft. This will prevent straining and constipation. Most importantly, call us if you experience a fever of 100.4 or higher, pain when passing urine, chills, extreme sadness or low mood, swelling in your hands or feet, severe headache or vision changes, passing clots larger than an egg, sudden large amounts of vaginal bleeding, or bleeding through more than one pad in an hour in at least 2 hours. Always call 911 if you experience sudden shortness of breath, onset of chest pain, or a seizure. I will be sending you home with written discharge instructions, information about your medications, and an informational pamphlet on postpartum preeclampsia, which will review the information I have provided you today. Do you have any questions? Okay. Well, our office number is at the top of your discharge instructions, so please feel free to call us. You can always ask for me if you do think of any questions going forward. Thank you. We'll see you in 6 weeks.